So that's it. There you have it. Dr. Ryan Cole, is going to need 5 yay votes from the 3 other counties under CDH jurisdiction. He's already received 2 from Ada County today, so 5 more would mean a majority of 7. Dr. Cole told us today, should it go through, it would be an honor, and he would be humbled to have the opportunity to serve the community this way. Going a different direction is how Commissioner Davidson explained why he wanted Dr. Cole on the board, as you just heard, and this would certainly be that when you consider the controversy that has surrounded Dr. Cole's name. Commissioner Kenyon touched on a couple of them. Even before stepping into the spotlight at a State House gathering put together by the Idaho Freedom Foundation, Dr. Cole was skeptical of masks and the vaccine. He has said publicly, masks don't work. We don't know what's in the vaccine. He called the latest version of COVID-19 a scariant, has called vaccine requirements tyranny with a needle. He's even referred to the vaccine as the clot shot and, yes, needle rape, and falsely claimed it could cause cancer or autoimmune disease. I asked him how someone who has said all of these things now finds himself potentially serving on a public health board.
Well, it's far beyond COVID. I mean, I've said some things that may be controversial. At the end of the day, it's still about sitting down and having a conversation, because there's not a one-size-fits-all answer to anything and everything in health. And I think in this past year, we focused on a one-size-fits-all for everybody. And I think that's the challenge, is everybody wants to cast aspersions or paint somebody into one side versus another. And honestly, that's not who I am. And it's not really my take on it. If to your audience, you always say certain things to a certain audience.
One would think in this era of a new virus and a new experimental, I don't even like calling it a vaccine, an investigational vaccine. A fake vaccine, okay, I can a clot shot, a needle rape, whatever you want to call it.
Do you really believe that the vaccine is needle rape?
No, that was more tongue in cheek, because somebody had thrown a comment from the audience, and I just said a couple other names that people have called it. So yeah, again, context, but I do think forcing something on somebody is not ethical, especially when it's still an experiment. I think that violates all international code. So to force it on people, I don't think is a good idea. I think it should be a person's choice, your body, your choice. If it's beneficial to some groups, great. If you feel like it's going to benefit you, great. But to force it on others, that's again a nuanced conversation.
You said back in March when you spoke at this Capital Clarity event, you said in a statement that you weren't part of any political party, organization, foundation, or special interest group, and that you haven't been part of any other Idaho Freedom Foundation events other than that Capital Clarity event. Yet last month you were at a summit held by America's frontline doctors who have been known to spread misinformation and false claims about COVID and vaccines. So I guess what's changed then between March and now when it comes to you and where you are?
Well, in that point, that group is non-political as well. There's science. Some people are political in that group, some aren't. My goal is, as a scientist, I don't care if you're left, I don't care if you're right, I don't care if you're red, blue, or purple. My goal is let's share data and science. So again, people want to paint me into a corner, and that's, again, falsely done, because again, you don't know me. And I have, certain views, but I'm not aligned with anyone per se. So if they want my understanding of science to help them, why not?
You've said before about COVID and the pandemic is to follow the money. Now, there's a lot of people out there that say your lab, your company makes money with people not getting vaccinated and letting this disease kind of run rampant because you do tests, COVID tests in your lab. What do you say to that?
I say I'm almost back to break even after investing millions of personal money I did not have, leveraging myself to help a community. Grateful, I'm almost back to zero, and I've served a lot of people. That's what I have to say to that.
Leverage money buying equipment?
Buying equipment, buying millions of dollars of reagents, buying millions of dollars of all the test tips and things you need in order to do the test. I put myself into debt to serve my community. If I get back to break even this year, I will be beyond grateful.
The mentality going into this is they wanted an outsider on this board. Do you consider yourself an outsider?
I consider myself a bridge and a unifier, because I will listen to everybody.
I asked Dr. Cole what he was looking forward to potentially being part of this board for the next 5 years, and he said he looks forward to serving the community health, that is, and this appointment is far beyond COVID. He hopes to help the city's under Central District Health jurisdiction to be healthier and be an example to the rest of the state. I did ask if he or any of his family has been vaccinated against COVID, as Commissioner Kenyon referred to, and he said He's had every other vaccine, but they won't ever take the COVID vaccine, which is not experimental, by the way, just authorized for emergency use. He spoke to us from the airport this afternoon, as you can see, on his way to be a guest lecturer at a couple of conferences in Tennessee. He wouldn't tell us what groups they were.